There are several important lifestyle changes that people can undertake on their own in order to reduce their risk of getting PAD, or if they have PAD, reduce their risk of it progressing. These include stopping smoking, improving your nutrition, so adopting a heart-healthy diet, and engaging in a structured exercise program. It's very important for patients with PAD to quit smoking because smoking is one of those factors that actually causes narrowing of your arteries.
There are many things out there that can help a patient quit smoking, such as patches, gum, medications, but the biggest thing I've found in my patients that have successfully quit smoking is just making up their mind that they're going to do it. So in addition to halting the progression of peripheral arterial disease, often when patients quit smoking, they find that they can walk further, they have less discomfort in their legs, and sometimes they don't even need the intervention that we were planning.
There are lots of tobacco cessation programs available today. So I would think of tobacco cessation as being divided into medical therapies and non-medical therapies. There may be a tobacco cessation program offered at your local hospital or community center. Tobacco cessation may be rolled into a chronic disease self-management program, so giving you tips and tricks on how to reduce your tobacco smoking on your own. If you need help, and many people do need help, there are medications that can be prescribed to help you reduce your desire to smoke, and that would be a conversation that you should have with your primary care physician or your cardiologist, who can recommend you to someone who can work with you as part of a medically supervised tobacco cessation program. Patients with PAD need to be very meticulous about their foot care, very similar to if you were diabetic. And this is for several reasons. When you have reduced blood flow to your legs and your feet, you may actually develop a condition called neuropathy, which means that you're less likely to detect small injuries, or your shoes may be too tight and you're not aware of it. And over time, that neuropathy, combined with the fact that you don't have good blood flow, can result in small sores, breakdown of tissue, and those small sores can grow into bigger sores that create a problem.
I think there are two important complications that can occur when PAD is not well managed, and the first, of course, is the risks associated with cardiovascular disease, and patients can have unnecessarily high rates of heart attack and stroke when they're not on appropriate treatment to lower that risk. The other consequence of peripheral artery disease when it's not well managed is the risk of progression, where patients with PAD start with claudication or pain in the legs when they walk. That gets to a point where they no longer feel independent, and their ability to care for themselves become more dependent on others, and depression can then be an issue. When peripheral artery disease advances to the extremes, patients can have pain in the feet at rest all the time, and of course that's quite painful. And patients can also get ulcers or even gangrene in the lower extremities, which can lead to amputations or including a below-knee amputation.